My name is Dr. Ben Howdigi. I'm the founding board chair of the Inland Coalition on Aging. I have the privilege of representing the coalition, representing you, but the coalition, the coalition members are the folks who are improving services for older adults, adults with disabilities, and caregivers. So thank you so much for all the work that you do in the community. This is a coalition, so organizations that serve older adults, people with disabilities, caregivers are the driving force behind the work that we do. It's not me doing the work, it's not the board doing the work, it's you doing the work. And so I just want to mention that we thank you for all that you're doing in your organization and all that you're doing collectively together with our action teams. We are going to hear a little bit more about our action teams in just a bit. But I want to welcome you, all of you. Marissa, thank you for joining us. Angela, good to see you here with us. Giselle, lots of folks, lots of representatives from various social organizations, healthcare related organizations. Good to see everybody here. I'm gonna go ahead and turn it over to Elizabeth Bogumil, who is our consultant, a longtime consultant with the Inland Coalition on Aging. She's been helping us since the beginning with the development of our master plan for aging, and she continues to work with us to help us get our IEMPA action teams off the ground. So you're going to hear a little bit about these groups, but I invite you, if you're not a member yet of the coalition, to join the coalition. Janelle, if you wouldn't mind putting the link to the ICA website, the Inland Coalition on Aging website. If you're on this call, please note that we welcome you, but we invite you to join as an official member of the coalition. You can join simply by entering your contact information. That's it. It's free, no cost. As long as you're professional working in the field, affiliated with an organization, have some type of title with an organization, you're welcome to join. So I encourage you to join so you can continue to get all the updates, everything that's happening with the Inland Coalition on Aging. We've got some exciting updates today that our action teams are doing. And then we have an amazing presentation today by the Archstone Foundation. I'm excited to hear more about Archstone Foundation, one of our previous sponsors. And so I want to acknowledge that also. But I'm going to turn it over to Elizabeth, who's going to tell us a little bit more about the IEMP action teams. Elizabeth?
Thank you so much, Ben. I want to invite everybody here, if you're not already involved, to participate in our action teams. We have teams that focus on several different topics that all align with the IEMPA goals. In the chat, I posted how to reach out to us. But for those who aren't reading the chat, we have a housing action team, behavioral health and social support action team, transportation action team, safety, respect, and equity action team, caregiving, Alzheimer's, and other related dementias action team. And in November, we're going to be starting our advocacy action teams. And although we've had about 2 meetings and we'll have our third meeting in November, it's open to anybody with a title who's participating in these topics. Maybe you work in this field or you're an active advocate in this field. We'd love to have you join the action teams. It's not weird if you miss the first 2 meetings. We've had a really good turnout, and I see this going in a really awesome direction. So we wanted to make sure that everybody was aware that they are invited. And if you'd like to participate, please email me at info@inlandaging.org and let me know what team you're interested in participating in, and we'll make sure to get an invite out to you, a calendar invite, and then we'll update you on what we've been talking about in our meetings. But also another plug specifically for the advocacy action team. If you're interested in advocating to policymakers, turning community members' stories into advocacy by taking those stories and bringing them to policymakers, or writing them up into op-eds, or speaking to the media about your story or other people's stories in your community, this is the team for you. We haven't met yet, and we're starting our first meeting in November. And so I wanted to make sure that anybody who is interested in being an advocate for the aging and disabled community, specifically surrounding the master plan goals, was able to attend and participate. So hopefully we see you there. And we're all really excited for the work that's going forward. I'm going to pass it off to Ben now. You're muted, Ben.
Thank you, Elizabeth. Appreciate the update and appreciate all the work that you are doing with the action teams. What I love about these groups, they're called action teams. They're actively looking at objectives. They're going to be looking at objectives, setting some goals, and really getting things done. That's what I love about coalitions. A little bit different, right? We're focused on something. We've got some goals in mind. We're moving the needle, hopefully, to make an impact in the community, right? Our goal at the Inland Coalition on Aging, or our mission at the Inland Coalition on Aging, is to improve services, specifically long-term services and supports. Long-term services and supports refer to those services that help older adults, people with disabilities, caregivers to really live independently, age well in the community, and just improving those options and those services that are out there. So very excited to hear the updates from the action teams. Look forward to hearing some more. Okay, we have some updates here. Is this me or is this someone else, Janelle?
That'd be Carmen.
Carmen, welcome. Carmen, I want to welcome Carmen to the next section. Carmen is the treasurer for the Inland Coalition on Aging, but also the executive director of Inland Caregiver Resource Center. Carmen, take it away.
Thanks, Ben. Just additional updates and information about the coalition and the work that we're doing. One of the main things that will help us have a successful Inland Empire Master Plan on Aging is us continuing to collaborate, right? Continuing to have these meetings, coming together, learning together, implementing the goals and the activities, not reinventing the wheels, but kind of more aligning with one another. And so that includes spreading the word about the coalition, getting other organizations that may not already be involved to get involved. And so we ask all of you here today to help us with that. That's what's going to make this master plan successful, and also help us enhance the services for our older adults, caregivers, and adults with disabilities in the Inland Empire. We have the marketing tools available for you to access. Visit our website, inlandaging.org/media, and you can find all these tools there that are available to you. We are also open to making presentations. If you're new to the Inland Coalition on Aging, want to learn more, want us to present to you, to your staff, to a group of professionals that you already have meeting in other collaboratives, we're happy to make presentations. We've done presentations throughout the year about the master plan specifically, and then also about how the Inland Coalition on Aging works. So help us continue to spread the word. Find us on LinkedIn, follow us on LinkedIn. We post there regularly updates about the coalition activities that we're participating in. And then, if you have anything that you want us to share with the group, please send it over our way. We're happy also to promote services that you are offering that align with the Master Plan on Aging and with the coalition work. So help us spread the word so we can continue to grow the Inland Coalition on Aging. Thank you.
Thank you, Carmen. You said it well. What is to me the key about a coalition is that work that you are doing, that we get to support, that we get to highlight, that we get to just support you. We had an amazing meeting recently with Don Smith and his the collaboratory that he has in the west end of San Bernardino, and we met and we talked about how we can support each other, how we can leverage each other's resources, and that's what this coalition is about. So know that this is not about the coalition's work. It really is about the work that you're already doing. The work that you're already doing is If it's aligned with our mission to support older adults, people with disabilities, and caregivers, we want to know. We want to know how we can support you. We want to know how we can work together. And it's probably through one of our action teams, right? The work that the action teams are doing, the work that you're doing, probably are already aligned. So know that if you join one of our action teams, it's not you working for the goals of this coalition or this action team. It's really about we have this goal, part of this action team, right? And how does it align with yours? How do we work together? So know that there's probably lots of synergy there, lots of opportunity to work together. Join one of these teams, and you're going to find out that really it's about how do we help each other and how do we leverage each other's resources and how do we keep moving the needle forward. So thank you for that. Next, I am very excited about this presentation. I know about the Archstone Foundation. They've been a great support to the Inland Coalition on Aging. They're doing amazing work, not just here locally, but across the state, across the country. So very excited to have Herson here today. He will tell you a little bit more about himself and the Archstone Foundation, but let's give them a virtual round of applause. Herson, thank you.
Thank you very much. And thank you all for having me today. I'm really excited to share about the foundation. And as I introduce myself, I'll get my slides up here, and hopefully everyone can see those. My name is Gerson Galdames. I'm a program officer at Archstone Foundation. I'm a gerontologist by training, specifically in research. So I was an elder abuse researcher for a number of years, working under Dr. Kathleen Wilbur at the University of Southern California, where I did a project funded by the Administration for Community Living on multidisciplinary teams as interventions for elder abuse, which actually took me all the way to Washington, D.C. for a health policy fellowship with the Robert Wood Johnson Foundation, and then not shortly after into the world of philanthropy, which is why I'm here speaking with you today. And so I am really excited to speak to an aging coalition in the Inland Empire. I think it's really crucial that we continually come together to elevate these issues and to build up to some of the efforts that are happening across the state as well. So let me just dive right into um, the mission of the foundation is fairly straightforward. You know, we're a grant-making organization dedicated to improving the health and well-being of older Californians, and very importantly, their caregivers. So a little bit of history of the foundation. We were a healthcare conversion foundation. So we started, I think, in 1985, and was basically the purview of the foundation was general community health, primarily in Long Beach, California, but there were some interests on the board to look statewide. And then in 1995 the board decided to focus exclusively on older adults. And since then, we've been the sort of funder that focuses on sort of issue-specific kind of funding. So, for example, for a number of years, we were doing elder abuse work. So, really funded a lot of elder abuse research projects, and then moved into things like fall prevention. Um, we've done depression in late life and then specific caregiving work. So historically, you've focused on one issue at a time. And I would say that in the past 5-ish years, we've transitioned into focusing more on sort of systems level change, I would say. So not focusing on a specific issue or like wicked topic like elder abuse, but instead thinking about how we can be critical infrastructure for some of the work that's happening in California related to Medicaid, specifically like CalAIM, with enhanced care management and community supports. So thinking about how we can be that sort of private philanthropic dollar that can help with pilot projects and things like that. But you're actually catching us in a really interesting moment because we have undergone a strategic refresh in the past couple of months, and also invited a new leader, Enrico Saborio. I'm sure some of you are familiar with Rigo. He came to us from the SCAN Foundation and is now a fantastic president and CEO, and has really guided us into a really interesting area. So. What you're going to be seeing today is actually not on our website yet. It's not been, super publicly announced. We've had conversations with folks and shared it out in meetings like this, but it really is kind of a sneak peek into what we're thinking of. So happy to dive into where we landed on our strategic refresh. And I'll just say that before we dive in. We have what we call our Jedi principles that we see as interwoven in all of our work. Jedi stands for justice, equity, diversity, and inclusion, and it really embodies, four basic principles of prioritizing underserved communities, really focusing on enhancing inclusive and person-centered, family-centered care, addressing health disparities and tracking the progress of addressing those disparities, and then centering community perspective. So let's dive right into these kind of new strategy areas that we're thinking of. So first is community advocacy, capacity building, and systems change. So we like our groups of three in philanthropy. I don't know if you've seen that, but there's three new strategy areas, and I'll dive into the first one here. On community advocacy. So, as I mentioned, Rigo Saborio, he is really a community advocate by training. And I think as a collective, the team at Archstone, um, really personable folks. We like to get into community. We like to build relationships with leaders, with the older adults in communities across California. And so I think what we were focusing on before, which was like kind of pure systems level change, um, we saw a need to expand on a strength of the team, which was going into community and building up the power and understanding of the older adults themselves in those communities to understand that they have a voice in um, in advocating for the policies and the programs that they need, and also helping folks recognize that that there are gaps in the ways that we provide care to older folks. I think it's really critical that it's not just us as professionals in aging organizations that are communicating to policymakers and to the folks in power. I really think that building up that civic engagement, that advocacy strength, and the general public's attention to older adults themselves is critically important for moving forward. And I think is a lot of the reason that we hear things like the master plan for aging. We don't want it to sit on a shelf. People talk about like things sitting on shelves. Things sit on shelves because there's not enough energy around the constituent bodies that are most affected by the work. And so we see that as a real opportunity for us to think about how we can help older adults lean into their power, and work with organizations that are already doing advocacy work, that might be thinking about what advocacy work might mean to them, and see how we can enable the people in the community to get involved in some of those projects. So I'll move on to um, this next area or aim. And it's really around capacity building. And, we have a very successful and popular capacity building program up and running. It's an annual program where we provide up to $50,000 for projects designed to help organizations build in infrastructure, bring in billing folks, bring in consultancies to think about how to fundamentally change the way that they're working in their organizations. And this is really born out of the concept that as a private funder, we're not able to fill the gap left by, for example, in this day and age, the federal funding cuts, we're not able to fill, the trillions, the $1 trillion that's coming in the next 10 years. And there's just so much need that we felt that, with these limited dollars, it would be best to work on capacity building to leverage what we have. And so, for example, we've given a capacity building grant to an organization that brought in a billing person. That person was able to bill CalAIM for a lot of the community supports and the CHW work that they were doing, and actually was able to bring in about $3 million in additional revenue because of that one position that we brought in. So that's the sort of return on investment that we're thinking about for this capacity building program, and trying to get smarter about how we provide support to folks. So we see this as sort of like another way to kind of talk about this is organizational resiliency, right? How are we building in things that'll help folks weather some of these changes on the federal side, and hopefully weather it through long enough so that we can see it on the other side, and provide different kinds of support as well. And then, of course, we have the systems change element, which I talked about, the past 5-ish years or so. We were thinking about how we can really use teams, how we can use training and technology to help the integration of health and social services. And that really involves things like learning collaboratives across different organizations, health and social organizations, helping community-based organizations contract with managed care plans, contract with, larger health systems, which they really, generally has been kind of a lift for folks. And then also getting involved in things like California's Master Plan for Aging. Archstone Foundation's part of a sort of funding pool of the different aging funders that provide this, repository of really flexible philanthropic dollars for the California Department of Aging to be able to use, and for example, to launch pilot projects, to bring on consultants, things that some of the bureaucracy in the state, it would just take too long to do. That role of philanthropy of like really infusing quick dollars so that you can kind of get your work out. I think that's sort of where we were seeing our role. And I think some of that is really living on in this area, the strategy area. So we really see that community piece, that, I first talked about, that community advocacy piece building up into systems change. I think we really want to have sort of, we talk about grassroots a lot, but we're also thinking about grass tops, right? So we want to talk about like the California Department of Aging. We want to talk about some of these like bigger national organizations that are playing, on the national scale. How can we connect them to down to the ground level in California so that the older adult voices are permeating some of that decision making, and helping, galvanize some energy that's really sorely needed. So that is the overview of the foundation. I think, like I said, we are just barely wrapping up our strategic refresh on this. So I'm giving you an overview of where it landed. And I think right now we're in the brainstorming phase of how we can really implement a lot of these concepts. But happy to take any questions. Unfortunately, I couldn't see if there were questions coming into the chat. So if we could maybe take a look here. Yeah, if there are any questions, please let me know. But that's the overview of the foundation.
I'm looking to see if there's any questions.
I'm seeing one here about agencies that only support the senior population. That is a great question. I would say we have supported organizations that are not exclusively serving older adults. If their program has an older adult focus. So, for example, we've partnered with some family centers that, they really serve that intergenerational, that lifespan. They have families of all ages, but they might have an older adult advocacy day or something where they have, those families participating as well. I think that is within the purview of what we fund. But generally speaking, unless if there are no older adults involved, then that's generally outside of what we would consider. Um, and then, like I said, we really do find that that caregiver piece of our mission critically important. So if there are projects or agencies that are focused on caregivers as well, that's something that we would take pretty seriously. And then, oh, I'm seeing a question here about how we define older adults and is there a specific age that we go by? So we've decided on 60 as the cutoff for older adults. When it comes to some of the work being done around unhoused and homeless older adults, we do recognize that, a lot of those individuals do present biologically older because of chronic conditions and not being housed. It's associated with sort of advanced aging. And so in those cases, it's sort of a case by case basis. We do kind of accept that folks are operating under like 50, 55 for some of those populations. It really is just on a case by case basis. Um, and then a question here about the ways caregivers will be supported. I think as part of the master plan for aging, there are elements of it that are focused on caregiver respite. We've thought about ways that, when it comes to community advocacy, aging doesn't happen in a bubble. It's not like the older adults existing here in this corner and then their caregivers are way over here. It's sort of like if you want the older adults, you need to have the caregivers as well. So I think that's definitely top of mind. When I'm talking about these strategic areas, we're talking about the unit of aging in specific families or social groups. It's like we really recognize that it doesn't happen in a silo. So I think having that front of mind is sort of the way that we're going to make sure that caregivers are supported in the work. Um, there's a question here through CalAIM. Do you also provide funds for respite, for example, short-term respite? While someone waits for IHSS to be approved. I don't think that is something that's provided through CalAIM, but I would like to follow up with you if there is sort of a deeper answer. There's a lot to CalAIM that we can, I think, dig into. And if anyone here is sort of like a deeper expert on some of those things, and I welcome that answer.
I can add something to that. So I would definitely touch base with the person's health plan that they're enrolled with. If they're enrolled with IEHP, Molina, Kaiser, I would definitely have that person contact the health plan to see what they offer as far as respite services. Most health plans are providing that service, so definitely check in with the health plan and they'd be able to assist you there.
Thank you, Ben.
Sure.
And then I'm seeing a question here about can a coalition apply for funding? And are there agency size requirements to apply to the Archstone Foundation? A coalition can absolutely apply for funding. I'd say that there's our consideration would be, what is the goal? What is the mission? Is there a plan in place for something that you're trying to accomplish around advocacy, community advocacy, and system change? So that's something, if you want to open a conversation with a program officer at Archstone, we're always happy to just have one-on-ones, 30 minutes, 45 minutes to see kind of what ideas are floating in your head and seeing how we can turn that into a grant. And then in terms of agency size requirements, as far as I know, there are no agency size requirements. Generally speaking, we're not funding like United Ways, like giant organizations with huge budgets. But certainly on the side of like being too small, I don't think that you need to worry about something like that.
I don't see any other questions except the last. Oh, there we go. I was wondering because 24-hour home care provides 72 hours of respite under CalAIM for persons waiting for HSS. Maybe that's something we can discuss later. Courtney, definitely
Yeah.
invite you to be a part of the caregiving. I believe that might be the most appropriate one. Elizabeth, let me chime in if I'm incorrect there. But that might be a good one. Definitely want to talk about all caregiving, all whether paid, unpaid family caregiving, paid caregiving through IHSS, but definitely want to support folks and caregivers. So that might be a good one for you, Courtney. And I see one more question there. Is a nonprofit wants to apply, who is the contact or best path to access an application?
I would definitely look at our website. Thanks for that question. Look at our website for the program officers listed. There's contact information there. You can also contact sort of our main office, and they'll kind of funnel you to the next available person to start a discussion. And in terms of accessing an application, we don't have an RFP style process for our grant making, with the exception of the capacity building program, which is a yearly process. We generally do our grant making for the larger strategic grants on a rolling basis. So we strike up conversations with folks, see what ideas they might have. And then we go from there. We see kind of what size we're talking about, the duration, and then talk about sort of project aims as well.
Hmm. Thank you. This was very helpful. Thank you, Natividad, for that comment. Appreciate all the questions. Seeing no more questions, I think we can thank Dr. Gerson Galdames for his presentation. Thank you, Dr. Galdames. Appreciate the information you shared with us, and I'm excited to hear the new things that you're looking into. Your strategic planning and all that is definitely going to identify probably some similar things that we have here in our Inland Empire region. We kind of aligned our master plan with the state's master plan. We did our own focus groups, our own data collection, of course, community engagement to develop our master plan for aging, which we just rolled out this last year. And so excited to continue that partnership with you, connecting with you to see if there's other opportunities to work together and continue to advocate for our older adult community. So I don't see any other questions. So can we give Dr. Galdames a big virtual round of applause, please? Thank you.
Thanks, everyone. Thanks for having me. Appreciate it.
Thank you, everyone. So next on the agenda is okay, we're down to the end of the meeting here. Our next meeting is going to be on Tuesday, November 25th. Very close to Thanksgiving, but we have some things to cover, so we're still going to meet there. So hopefully you can join us. We are actually done we're done early today. Usually we go up until the last minute, but Elizabeth, anything you want to share about the action teams? I think now would be a good time. We have a lot of new people. I see new names, so I'm excited about this. Before I let Elizabeth share, I just want to, for those of you that are new, welcome. Inland Coalition on Aging has been in existence for about 4 years in this new version. We used to be another name, but we kind of revived a coalition to focus on long-term service and supports for older adults, people with disabilities, adults with disabilities, and caregivers, and really focused on. We thought the best way to do that is to create a local Inland Empire master plan for aging. So we did that after many years of gathering data, talking to folks face to face through surveys, gathering data to see what the needs of the community were, and talking to you, professionals in the field, community leaders, elected officials, we developed the Inland Empire Master Plan for Aging. So now we're in the implementation stage where we've developed some groups, action teams that are now going to carry that work forward. So we have goals. We've identified some things that are important that were identified through that collection of data and information that now this is an exciting piece, right? Now we get to actually act on it. And that's why we're calling them action teams. So we definitely need you to be a part of this actions team. I know many of you, I recognize lots of names, and I know that you are experts in your particular field. So we need you. We need you, Erin. We need you, Craig, Hazel, Alexis, Vanessa. We need all of you to be a part of this. Again, to connect your goals with ours. We're not asking you to take on more work and work that's not, that you are not passionate about. I guarantee if you're here, you're serving seniors, people with disabilities, and caregivers, we probably have a goal already set in mind that's closely aligned to work that you're doing. So let's please join one of our committees, and you'll see that there's much to work together on to improve the lives of older adults, seniors, and people with disabilities. I'm going to turn it over to Elizabeth really quick to see if she wants to share anything about the action teams. And then Carmen, I see your hand up. Elizabeth.
Yeah, so for the action teams, we're not really creating anything new from scratch. We're really seeing what already exists in the community. And what we found out in our needs assessment was a lot of services exist within the community, and we just needed to promote them further or to educate other providers in the community that these resources and services exist. And one of the best ways to find out what already exists is for all of us to join together in these action teams and share what our groups are doing. And that way, other groups in the action teams can promote them and say, hey, we're going to connect you with these resources. We know somebody who's already doing this within the community if an individual needs certain type of support. And we can also share amongst the action teams. Examples are we recently shared the transit plans for Riverside and San Bernardino counties so that community members who are part of our action teams could give feedback on those. And so it's a lot of bolstering and supporting what already exists and finding out and delving deeper into the projects that y'all are already working on to understand how they align with the goals. It's 1 hour a month on Tuesdays, second Tuesday of the month, except for next month, which is Veterans Day, so we moved it to the 18th. But send me over an email if you're interested. I tried to reach out to many of you individually via a message, letting you know where I think you might fit very well for the action teams. We already have quite a few members here too, who are attending. Y'all didn't get a direct message because I'm so happy to see you each month. But the work that we're doing is really neat and going in a very cool direction. So I hope to see you all there. I'm going to pop the email again in the chat. It's info@inlandaging.org. Shoot me over an email. There's a real person over there that responds. I do. And I'll send you over the information either to the action team that you think you'd want to be on or to the action team that I think that your work would align closest with. So I'll post that in the chat and hopefully I'll see you all there. And I'm going to jump over to Carmen now because she had her hand up.
I see a question in the chat asking what are the different action teams. Natividad, we have an action team that focuses on transportation, one that focuses on housing, one that focuses on caregiving, Alzheimer's, and related dementias, as well as safety, respect, and equity, and behavioral health and social supports. And we're going to be launching a new action team in November on legislative advocacy. So there's a lot of action teams. You could participate in more than one, although we encourage you to participate in one that you are most passionate about. There are a lot of activities that we're trying to go through and collaborate with. One of the main findings that we found during the development of the Inland Empire Master Plan for Aging is that there are a lot of resources in our Inland Empire. However, we are still working in silos. And so even though, it might seem like we're saying the same things over and over again, but it takes us saying the same things over and over again to have us work better together. And that's really kind of the ultimate finding that we have from the constituents in our Inland Empire is that we need to do a better job at working together, organizations serving older adults, caregivers, and adults with disabilities. We need to do better at working together. And so that involves meetings like these, participating in action teams, learning about each other, being consistent, and just continuing to work at it. We had a presentation today about Archstone. That's a great opportunity for us to collaborate. Organizations can collaborate with the ICA to put out some really strong requests for proposals from Archstone so that we can get some funding in the Inland Empire, right? So, that's bringing them here to talk about what they're doing is intentional, is so that you can ask questions so that you know what the requirements are. And then also so we can, join forces and maybe pursue funding together to help, stretch that dollar as much as we can. We know things are pretty tight right now all over. And so more collaboration is needed. And so I just wanted to emphasize that it's also about partnership in funding, trying to bring funds to the Inland Empire. So if you all know of any other funding streams that you want to share, let us know so that we can share them with others, so that we can bring some more of those funds to the Inland Empire to enhance the services of our older adults, adults with disabilities, and caregivers. That's all I wanted to say, Ben.
Thank you. Thank you, Carmen. Appreciate that. Well, we are at the end of our meeting. I won't keep you longer, but thank you for joining today. We invite you to come back next month and we'll have another great presentation and more importantly, be part of the action teams because that's really where the exciting work is going to happen, right? We need your expertise. We need your passion to help us with those action teams. So hope to see you there. I am on the behavioral health group and it meets next week. I can't wait to see you guys there who are part of that. I think we're going to go ahead and end the meeting now. Thank you all for being here. It was great to see you. Hope you have a good rest of the day.